A family can expect that when a gastrostomy tube is placed, the first thing that we'll run through it is just some clear liquid to make sure that a child tolerates use of the tube and that the tube is functioning well. Generally, within about a day, some formula is started. In a small baby or a toddler who may have a lot of reflux problems, it may be given as a slow, continuous drip at a fairly small volume initially, and then as the child tolerates it, increased over the course of weeks. In some cases, the full desired volume of formula, meaning the number of calories, can be ramped up over several days. Based on a patient's particular anatomy and medical findings, a surgeon may opt to put a long tube in when a gastrostomy is first performed. It's a fairly long rubber tube. It is soft and it can be rolled up and hid under a wrapping for the day when a child is not using it. When that strategy is used, it's generally about 12 weeks later that the child has that removed and converted to a button. That is an office-based procedure. It doesn't require an anesthetic, and it's generally pretty well tolerated.
You have to change the MIC keys every 3 months? 4 months.
We do it at home.
We do it at home.
Ourselves. We just order new ones.
It takes about 30 seconds.
The tube goes through the abdominal wall right into the stomach, so there's a little open track there. The tube or button can move around a little bit. There can be a little bit of inflammation there, and that can make the tube changes a little bit difficult, a little bit tender. But generally, they don't require anesthesia or sedation or specific pain medication. It's in and out quickly.
The G-tube is changed about every 6 months, and the first time that we had to change it, she did it herself under the guidance of myself and the doctor at the hospital, and it was pretty amazing.
We keep all this stuff right under their bed here. So you have the tube formula, and then that has all the tube bags. So it's nice and close, so everything's right here. And what we do is we come in, and she usually gets 2 of these a night, and it's about 500 calories in each one of these. So we give it a little shake, open it up, and then this is her tube bag right here. So you pop that open, pour these in, just be careful not to spill. I just did. And you can fit 2, just a couple drops. You can fit 2 in there. Close it up tight. Hangs on there. And then you have to prime this thing so that all this air doesn't go into her stomach, which could, kind of bother your stomach.
Yeah, because it made me throw up once.
Turn on the pump.
Can I do the priming?
Sure, you can prime it. So she's just going to hold that in, and it's going to fill up the tube with, okay, just kind of stand on the side though, with the stuff. And then this piece you keep every night. Every day. You wash it out, just rinse it out, and you can reuse this. This whole thing you throw away every day, so you use 1 a day. But you can use this we use it 2 a month, so about every 15 days we switch it out. You just jam it in there. And it's got a little medicine port on here too, that will show you how we put medicine into her if we need to. And then it has a white clamp, just to clamp it up whenever you need to unhook it. Because she's really good at night. She can get up by herself, unhook it, go to the bathroom, come back in, start the pump back up. It really works out well. So it's almost done priming.
What's that?
Almost.
It takes a long time.
Gotta hold it in.
I know.
And then
Please, I'm doing it.
I'll let you hook up since you know how to do it.
No.
Want me to hook it? Yeah. And we have it set to go in at about 115, 120 milliliters an hour, which means for 2 cans, it takes about 4 hours for her. So, almost there. Okay, that's good. Okay. Why don't you go ahead and hook that up?
Almost done.
Okay.
I've got to stop doing
Okay. So then she just takes it and she hooks it up. There's a little cap on there. She unhooks the cap, pops it in, And then you give it a little spin because it locks it if you spin it there. And then she goes ahead and starts it up. And now it's just going to pump in, like I said, about 115, 120
And then
milliliters.
every other
hour.
minute it stops. So it's not going to just like.
Yeah, it doesn't constantly
straight.
do it. It'll pump in like some, and then it'll stop, and then it'll pump in some.
Yes.
But then what we do, and a lot of times she needs to take Claritin for her allergies. So what we do
So
is
before we start this,
we pause it.
and then
She clamps it. Hold it up so they can see. She sticks it in the medicine port. Unclamp it. Squirts that right in. And then she closes the medicine port, otherwise it starts gushing out that way. And starts it back up, and then she goes back to bed. And she sleeps with this on, and it usually doesn't cause any problem as long as she's ready to start doing her sleeping. If she's in a kind of playful mood, we might hook her up because sometimes it'll unhook and then it gets on the bed or whatever. But she figures that out pretty quick, and we go ahead and do it, fix it for her. Then in the middle of the night, after this bag runs out, the pup will sense that, and it'll start to beep. And it beeps loud enough to wake up her mom or I in the middle of the night, but usually it doesn't wake her up, oddly enough, unless it goes on for a long period of time. And then what we come in is, we'll come in and we'll stop it. And then, so she'll be sleeping, and what we'll do is we'll clamp it. We unhook this piece here, and we just hold that. We put it up here like this. That's kind of our little tip that we all figured out, because if you just kind of hang it over, some of the stuff drips out on the floor. Stick this big syringe that just has water in it, and it's just tap water because that's what she would drink anyway. And then you just push it through like this to kind of clean out the little tube, because you're going to use it again tomorrow. It also cleans out the tube that's inside her body so it doesn't get clogged up. And then we just close it back up, and then she's sleeping that whole time, and we just let her go back to sleep with that on. And then in the morning she gives us that, and we do another little rinse out just to make sure it's cleaned out. But that's basically all it is.